I can't tell you how much their work here means to me. Without it, I don't know if I'd be alive by now.
I just have to do without, plain and simple. I don't have the money to go to a regular hospital and pay the bills. Just that simple.
I got a cancer, lung cancer. I come here with Dr. Dana. Dana told me, okay, you have cancer. Don't worry, you'll be fine. I have a tumor removed, and now I'm okay. Without family help, maybe I was dying.
The clinic is really a place where people could go who have absolutely no medical insurance to get good quality health care services regardless of the cost.
They do everything with, I don't know how to explain, but not for money or for something, because they don't do for money. They do for the health.
I'm paying, with my health conditions, I'm paying $2,300 a quarter for $5,000 deductible insurance, and it basically doesn't cover anything.
Without insurance and without the financial means to get health care, I knew my life was very much in jeopardy.
We try to be very aware of the fact that everybody who's coming to be seen here does not have insurance. So we always try to work around the system and try to get them the best care possible at the least cost to them.
Well, it's important because there are so many uninsured, and for most of them, they come here, this is like their last stop. They don't know where else to go. And what we're able to do here is provide them with preventative health care to try and keep them well so they don't end up using the emergency room as their primary care providers.
If you want to look at it purely in dollars and cents, it's very much cost effective to take care of them on the front end. It's a lot more effective, efficient, less expensive way to take care of patients than otherwise you would if they end up in the emergency room and the hospitals, basically consuming all of these resources that somebody has to pay for, and it's the taxpayers who end up doing it.
If we as Americans believe that public education is a right as a citizen, we believe that a public army to defend our borders is a right as a citizen, I never understood how we don't believe that access to health care is a right as a citizen. And so my personal view is that all Americans should have access to health care. And while we're debating that in this country, places like Family Health Partnership Clinic remain crucial.
In your regular practice, you're worrying about DRGs and HMOs and pre-certifications and a lot of extraneous stuff that's sort of clouded everything up and to a certain extent threatens to take away the joy of taking care of patients. But here, this is still basically just comes down to the simple physician, patient, without everything else going on.
The reasons I try to get young physicians to do this is because it broadens your vision, it broadens your view. You get to see more people from more different backgrounds, different cultures.
Have been through the system, have been without health care, have been on public aid, have been treated badly by health care providers, and wanted to be on the other side of that desk for those who came up there and needed help to be treated with respect and dignity, the same as if they had insurance.
I'm a vice president with the Gavers Community Cancer Foundation, and over the last, I think, 6 or 7 years have been very closely affiliated with the work of the clinic, what they're doing, and by far in that area we get a lot of bang for our buck.
Well, my personal rewards for being on the board at the clinic would be specifically that we know that although we're doing well as a company and that the families that are here at Sage are also doing well, we know that there's a lot of people in this community that aren't doing well right now.
I think the clinic serves a very real need. It's an important need, and I think our responsibilities in the community are to meet those needs.
We would like to see people throughout the community, businesses, donors, volunteers, also be energized by this challenge. This is the time that we really need to step up and serve this community.
I'm a volunteer interpreter. I've always had a soft spot for people who've who have illnesses, because we've had some things in our family to deal with. I feel like I'm still contributing to society, because you know, once you retire, you could just go play golf every day.
When you are here, you are face to face to people, so you are close to the heart and the soul to the people.
Sometimes it can be frustrating, but mostly the reason I like it is you're touching somebody every day and making a difference in their lives. And that's the best part. It's the reason I went into nursing in the first place.
If people get sick and can't go to work, that affects the economy. If people wait and put off care until it gets so bad that they need to go to the hospital, that's a huge drain financially on the hospital. When the hospitals start to go under, the whole base of our healthcare system starts to go under. So it's really our goal to keep people well, to keep people healthy, do a lot of prevention, as well as doing some of the primary care. And it's not the way that healthcare should be delivered across the country. But we can really make a difference in the lives of the people that we serve, which is close to 4,000 every year. And it's those differences that really keep us going, and to know that we've really made some significant headway in keeping them healthy, keeping them in their workplaces, and keeping the people around them healthy as well.
I would really say to my fellow physicians that this is an experience you should have, and it's not only going to be something that you will extract joy from, but it's the right thing to do.
This clinic runs because doctors volunteer. And if we don't have more and more people agreeing to spend their time, we're not going to be able to continue this great service.
There's lots of good reasons to do it, but I find that the environment here is actually really fun. Everybody's great to work with. It goes by really fast, and you've got wonderful nurses and staff that you're working with.
You really feel like you make a difference in people's lives. I think it's the most abundant use of 3 or 4 hours out of your month that you could possibly do to do the most good.
It needs more donations, it needs more doctors, more specialists, because people come in with an illness and sometimes the doctors are frustrated because they need a specialist in, you know, like a dermatology, they need a specialist in some other field, oncologist, and there is no one to refer them to.
If you can find it in your heart and in your schedule to give us 3 hours a month, you can have an amazing impact on people that are underserved here in McHenry County.
I'd say thank you for all the help and goodness that the people have portrayed to me. It just makes for a better world all the way around.
Oh, I would like to say thank you always, because they always here to serve.
I would say 1,000 thanks. And thanks for being here and doing this job.